Tonight is a celebration, as I said, about a personal initiative about private enterprise dealing with a big public policy issue. Now, the bloke who's got the carriage of the public policy problem here in Queensland is our State Health Minister. He has spent half of his life in the Queensland Parliament looking for the opportunity to make the kind of difference that he is right now on a daily basis. Please make welcome our Health Minister, Lawrence Springborg, because he's been listening to all of this, and I think he'd be happy. And I know that there's a lot of things that he could do, but the fact that he has chosen to be here tonight says something about this man. Please make Lawrence Springborg welcome. Thank you.
Thank you very much, Gary. I might hold on to it then, I've got it out of the thing. So thank you very much, Gary. And can I also acknowledge my good friend and parliamentary colleague and member for Sunnybank, Mark Stewart. It's great to be here in your patch tonight, Mark. To Councillor Kim Marks, to also David Lynn, who is the LNP candidate in rank, and Anne Zaffa. Thank you very much for your very warm invitation, the privilege to be here tonight at the official launch of Dial a Doctor. And can I also thank so many people who are associated with Dial a Doctor. That's people that are actually partnered in the business, those that actually work in the business. But ladies and gentlemen, more importantly, each and every one of you that obviously support very much this fantastic initiative, and there are people that have travelled here tonight so near and far to be a part of this extraordinary celebration as well. As Queensland Health Minister, I've been given an enormous privilege, and some people might be surprised at that, but it's something that I enjoy very much. It's not without its challenges, but being Health Minister is something that really does have a major impact on every person's life, if not this week, next month or next year, or someone that you love and is very, very dear and near to you. So health is extremely important in your community, in our community. To put it in context, the job that I have in Queensland, when I started in this job around about 14 months ago, I had a budget of about $11 billion. This year my budget is $12.3 billion. I am the proud custodian of 26.9% of the taxpayers' money which is spent by the state government in Queensland. The Education Minister has 23%. So between myself and the Education Minister, we look after 50% of the state's allocation of funds. The other 17 ministers, including the Premier, have the other 50% between them, even though you could probably argue that the Premier has a fair bit of direction over the lot. But that really puts it into context. So I presided over an increase of just over $1 billion. But money's not everything. The other essential aspect of running health in Queensland is about ensuring that you have good management structures and you have really good partnerships. And I am proudly the Minister for Health. I'm not the Minister for the public health system, because the health system has many facets. It's not only our public hospitals, it's not only our community health centres and all of the aspects that go with that, but it's also working in partnership. Because you might be mistaken for believing that the public health system is the only employer of doctors and nurses in Queensland. Indeed, more than half the nurses, over 30% of the nurses that are employed in Queensland, are employed in the community, not-for-profit and private sector, not by the government. Indeed, probably 10,000 doctors are employed outside the public system as well. So from my perspective, it's very important to make sure that this is about partnerships, because it's the only way that our health system can really work, and we shouldn't be balkanised. We shouldn't work them and us. It should be public, private, not-for-profit, the community health sector, working all together. And that's why I was very privileged to receive the invitation from Zaffa on behalf of the Dial the Doctor, or Dial a Local Doctor, to be here tonight. Because one of the big challenges, and Gary alluded to it a moment ago, was taking pressure off our public hospital system. We have had, over the last few years, a 7% growth each and every year in presentations to our emergency departments, the fastest growth in all of Australia. Indeed, our emergency departments last year saw around about 1.3 million emergency department presentations. 583,000 of those were in category 4 and 5. That's the lower urgency categories, and only 14% of those are actually admitted to hospital. And the reason that I raise this, ladies and gentlemen, is where Dial a Local Doctor comes in, because most of those people can actually be seen and looked after by a local doctor in the community, visiting them in their home or their local GP. And the reason that so many people come to our emergency department is they can't access a private GP after hours. And that's why this is extremely important. Because when people actually decide to access health services, they need to ask themselves this question: is this an emergency department issue, or should I go to a GP? GP or ED? Sometimes they call 000 because there's nowhere else to go, or they drive down to the local emergency department. Now, we don't want to discourage people who are in serious emergency situations from coming to an ED. That's exactly where they should go. But we want to encourage more people who are in that category 4 and 5 to go and see their local GP or dial an after-hour doctor. That's why I love this concept. That's why this is a fantastic concept. And Zafar and your group really need to be congratulated enormously for what you have done here. Our emergency departments in Queensland in the last 12 months have had extraordinary performance increases just by changing the way that we manage them. Indeed, the number of people getting through our EDs in under 4 hours has gone up from 65 to 76% in 12 months, just by running the EDs different. We aim to get them to 90% in the next couple of years. But the real problem for us is the more efficient we come with our emergency departments, the more people might want to actually come down to us, because our average wait is 18 minutes. And it's probably quicker than you can go to your local GP. So that's why something like this is so vitally important, and certainly for the average person who wants to use this service with a sick child at home or they're sick in bed, to be able to ring up and have that good old-fashioned care. And I note that our Rotary guest here tonight said years ago the doctors made house calls, so it makes sense that we should be able to do this today. It's a fantastic initiative. We're really interested in these partnerships. It does make a difference. I hope and believe that this model is going to be an extraordinary success. We're talking about 10 communities and their surrounding districts in Queensland now being serviced by Dial a Local Doctor. It's such a successful model, I believe. It'll go on from strength to strength. Once again, Zafar, congratulations, great initiative. All strength to you, and we're happy to support you and partner you. Well done.
Thank you, Minister. Lawrence Springborg, ladies and gentlemen.